Asthma attack and heart attack are very similar. Sometimes it's very confusing whether it's heart attack or asthma attack. There's a possibility of misdiagnosis. And especially when you're talking about cardiac asthma, the attack seems to be asthma attack, but actually it's not. The attack is by heart. So it's very difficult to identify whether it's heart attack or asthma attack. And when you don't understand, there will be a difficult thing because it's difficult to treat. Treatment is different. When you have asthma attack, treatment is one way, and when you have cardiac arrest or heart attack, the treatment is different. In these cases, the symptoms are wheezing and shortness of breath. So when it is heart attack, how can you guarantee that it's not asthma attack? When you think it's asthma attack, how can you guarantee that it's heart attack? So even when the heart fails, there will be the wheezing and shortness of breath. It seems to be asthma attack, especially when you have been suffering from asthma. It's very likely that you think that this is asthma attack. But when you have asthma for a long period of time, it develops heart disease. So asthma disease is a lifelong process. It is a chronic disease. But if you do not keep it under control, then what happens? It can lead to heart problem. A heart attack comes from atherosclerosis problem. The plaque is formed because of excessive calcium in the blood and excessive LDL, low density lipoprotein in your blood. It's true. But the symptoms are very similar. Symptoms are body's language, and a language is sometimes ambiguous. And a language can also be metaphorical. So it's very difficult to identify separate heart attack from asthma attack. Other thing is that the chest, there is a central cavity inside the chest, and there sits both heart and lungs. How can you separate? It's very difficult. One is affected, the other is affected as well. One effect leads to the other. When you are talking about asthma, it's because of inflammation in the airways. And if you are talking about heart, then there is arterial blockage. So both lungs and hearts are very close by. Asthma is a chronic condition, and there is a fight between immune system and environment. So everybody has got immune system inside, and because of the environment, suppose dust, pollen, cockroaches, dirty places,